Well, many people who have recovered from COVID-19 still have trouble breathing or regaining their strength. Here on Long Island, St. Charles Hospital has developed a post-COVID outpatient rehabilitation program. Joining us via Skype is Laura Beck, the Vice President of Rehabilitation at the hospital, and Pattianne Ruppel, the Director of the hospital's Rehabilitation Center. Thank you so much for joining us.
Hello, good morning. We're happy to be here.
Thank you.
So tell us what people are experiencing once they're done with COVID, but they're not done recovering.
So the most long-standing symptoms that people are having after recovering from COVID are fatigue, shortness of breath, weakness. So we just felt there was a need to fill and provide some of these patients some place to go to have some recovery from the more longer-lasting symptoms.
And what are you seeing? It varies from patient to patient?
Yes, it does vary from patient to patient. It really is a very individual process. So when the patients come in, we do an evaluation of each patient before we design a program for them and put them into the classes.
Are you seeing some more of the fatigue? Is there one thing you're seeing more than the other?
It really varies from patient to patient. I would say fatigue is probably fatigue and endurance and muscle weakness are definitely the most common things that seem to be lingering on in these patients. But it is definitely varies by the individual. But I would say yes, that is probably the most common deficit that we're seeing.
So when they come in, what kind of physical therapy do they get?
So we did model this program after our pulmonary rehab program, which because the lasting effects seem to be kind of in line with those type of patients. So the things that we work on with the patients is a lot of cardiovascular training. So things like treadmill walking, UVE, anything to get the heart rate up and build endurance. But then we also will do a strengthening program as well as a lot of exercise education to the patients on how to adapt to any deficits that they're having and how to have home programs that they can continue to work on addressing the deficits that they have and hopefully continue to recover.
I wonder, a lot of them have to be surprised. I know I have a friend who's in great shape, but she just could not, her fatigue level was so bad afterwards for a very long period of time. You finding that with many of your patients that they just can't come to again?
Yeah, it's so strange, and it's not like one particular age group, and it's really very diverse in the types of patients that are having these lasting effects. And we really don't know how long it's going to linger on because our program's very new. We're just starting to see the patients, but it is very interesting how these things just seem to persist and persist and persist.
Now, do you, when a patient comes in, they get an individualized program because the symptoms or the after effects vary?
Yes, the patient is referred to us by a physician for physical therapy, and we do a thorough physical therapy evaluation to determine exactly what the deficits are, and we design an individualized exercise program for each patient.
And there's group sessions as well?
Yes, we do put them after the individual evaluation. We do treat the patients in a group setting unless their deficits are so severe that we feel that they would benefit more from a one-on-one treatment.
Who would you
and
recommend?
The group exercise.
I'm sorry, go ahead.
I'm sorry. Well, I was going to say the group sessions, it's a monitored exercise program. So during the course of their exercising, we're monitoring their pulse oximetry, we're monitoring their blood pressure, their exertion level so that the patients feel safer. Sometimes when they're shortness of breath or get easily fatigued at home, they're fearful of exercising. But in a controlled environment where they're being monitored, they feel more comfortable kind of pushing themselves a little further to see what they are able to tolerate.
And maybe with the medical staff there too, they like you said,
Right.
they will push themselves a little bit further than they would at home and
Yes,
recover
exactly.
faster. Who would you recommend come in and get rehabilitation?
We are seeing any patients who had a COVID diagnosis. They have to be at least 14 days out from the diagnosis. And any of those patients, as long as they're asymptomatic, 14 days out from the diagnosis, they get referred by their physician and they're appropriate for the program.
Okay, Laura, Pattianne, thank you so much for all the information. We're going to put up a phone number. Anybody can call for more information. The number is 631-474-6111. Thank you.
Thank you. Thank you so much.
Thank you.
Have a great day.
You too. More CFN Live right after these messages.